Okay, ladies and gentlemen, let's get underway again. I'd like to introduce our next two speakers, both of whom I have had dealings with for many, many years. Emiliano Zucchi, who's the CEO of VITS LanguageLoop, and Dr. Jim Hlavac from Monash University. I'll hand over to them now. Yeah. Advance the slide back, and that's the right. Point at you. Okay, thank you.
Good afternoon. Thanks for that, David. Can I please start by acknowledging the traditional custodians of the country throughout Australia? Oh, can you hear me? Don't need it. Okay, this one here. And their connections to land, sea, and community, and pay my respects to elders past and present, and extend that respect to any Aboriginal person who might be here today. I would also like to thank Uncle Wally for his kind words. Our offices in Naarm, in Melbourne, are located on the lands of the Kulin Nation. We know very little about what people with limited English proficiency, so people who require interpreters at critical points of care, understand of the role that professional interpreters play. So it's a good question to start this talk with. Do we all know what people with limited English proficiency think of your role as professional interpreters and translators? And we know just as little, I suppose, about what a clinician's understanding of that role might be. There is an obvious research gap in that area. So this is a space that a few of us stepped in a few years back. And I'd like to start by acknowledging the people who try to find out the answer to fill that gap, that research gap in some way. So we conducted, back in 2016, I was still at Northern Health, we conducted a series of surveys and then published some articles. And that research was done thanks to the work of people in the audience here. I'd like to thank them personally, Yue Hu, Stefania Zen, Ida Dracho, and then Yue, Jim, and I went on to publish those results. I would also like to acknowledge and thank Professor Inka Chris. I'm not sure if she's here yet. I can't see it with the light, but also research that we did with Inka around clinicians' understanding of an interpreter's role informed this work that we're presenting today. So to start off with was a large-scale survey of about 1,000 Australian residents with limited English proficiency across 17 different languages. And this shows that there are a wide variety of views about what interpreters do. Most people do appreciate the work performed by interpreters, but many simply don't understand what the role really is. For example, over 40% of patients do not know that professional interpreters are bound by a code of ethics. And even the ones who say that they do know, it's questionable whether they actually do understand what it entails. Fast forward a few years, I now work at VITS LanguageLoop. We have an innovation fund, and we commission Jim to develop a resource, namely a poster, to address information gaps amongst users of interpreting services. And we're here to present that poster today. And it's really, really important to stress that that poster has been endorsed by the AUSIT National Council, and I'd like to take the opportunity to thank Carl and the National Council for considering the poster and endorsing it. The poster, it says they will be translated into the 10 languages. In actual fact, it has already been translated in 15 languages, and it is available already on a landing page that leads to the AUSIT website. And the intention is to distribute this poster free of charge to hospitals, healthcare clinics, courts, government services in Germany. Okay, I'll pass over to Jim now for some of the data work.
Thank you, Emiliano. As Emiliano said, we as interpreters often don't know how it comes to be that the clients that we're working with came to need an interpreter. Did they request one? Did someone else ask for them to have an interpreter? What perception do they have of the person that they're about to work with as the interpreter? And as a trainer, etc., this is something that we teach to trainees, to actually introduce yourself and your role. My name is Jim. I'm your English Croatian interpreter. I'll be working with you today just to share with you some information. I'm impartial. Everything that you say will remain in confidence. I'll also be interpreting everything you say or the other person says. If there's something you don't want me to interpret, don't say it. Do you have any questions? So that they know in a nutshell what it is that you're going to be doing when you're working with them. As Emiliano said, this is a project to find out amongst different groups of speakers what their perceptions were. And so the sample that we're presenting today encompasses these languages. These were collected over 3 periods, 2016, 18 and 20. They're not necessarily representative of all of the clients at Northern Health who sought interpreting services. Every month at Northern Health in this period, they had between 3,000 to 4,000 interpreting assignments. Over this period, we collected 1,200 informants. But it's highly indicative, we think, of what the clients who use interpreting services, their background is. In general, this also conforms with those language groups which sought interpreting services in this period. So when we look at the data in terms of how long they've been in Australia, we can see that the largest single group has been here for over 10 years, which responds to an assumption or an expectation that some people might have that with the continuing passage of time of living in Australia, you won't need an interpreter. For many people, that is the case as they acquire English, but for a lot of people, that's not the case. And in particular, in health situations, where the type of language used can be quite different from otherwise, it's important that there is clarity about what the patient says to the healthcare professional and they understand them, and vice versa. We asked some obvious questions to check really what their profile was. How difficult do they find it to communicate with doctors, etc.? And those are the results, you can see them. These are unsurprising. The next question is a contentious one, because it's not congruent to policy, both healthcare policy at Northern Health, as well as other guideline policy documents. We'll be hearing also later about the clinicians' guide to working with interpreters that advocate the use of an interpreter, not a family member. But we asked this question nonetheless, and we can see here what the responses were, that sometimes, or even yes, a substantial proportion do rely on family members or friends. This is an unsatisfactory situation, but it's one that we still need to record to be able to look at how frequent, how often this is happening. Another thing that we wanted to ask, and although these people are at Northern Health, they are about to or just have used interpreting services, did they know that it is their right? Healthcare policy in this country is very progressive. It seeks to remove any linguistic boundary which might exist between a patient and a healthcare professional. And the way to remove that barrier is an interpreter. That's the obvious remedy. Most believed or knew of this right, but not all. Even though this is something which we believe is quite heavily publicised, there's still a proportion who participated in this survey who were not aware of this. And this is another obvious question, but we needed to ask it, what their experience had been. For some, this was the first time that they were using interpreting services, but most had already had previous experience. Now, Emiliano talked about how it is that they come about to have an interpreter. It's straightforward if they request it themselves, but some people might be reticent. People might feel embarrassed. people might be under the misapprehension that they have to pay for these services, and so therefore they don't request them. And sometimes linguistically they're not able to anyway. In that case, typically a family member or someone accompanying them requests their services. But there are still some barriers, and there's some great resources produced by the Centre for Culture, Ethnicity and Health, which talk about how service providers can work with the person who they're interacting with for the first time. If they detect that there's issues with their ability to communicate in English, how they go about offering and providing interpreting services. So we see here that in actual fact, the minority of informants requested the services themselves. Instead, it was actually Northern Health staff. Or, if it was in the case of a referral from a GP, that person had identified their need for interpreters, which really shows you the key role that front of desk healthcare professionals or healthcare staff members play in ascertaining, requesting, and securing interpreting services for that patient. They're actually doing it 2/3 of the time. That's a really important finding, and also backs up our policy guidelines, which are quite clear what instructions go out to healthcare providers for them to be able to support their work. And in this case, the work is being done by them. This is a high pickup rate, but we don't know if we're picking up everyone. We suspect that not everyone still is being encompassed. Last but not least, we asked them, did you know that interpreters are bound by a code of ethics? I talked about some ethical principles before: confidentiality, impartiality, accuracy. They need to know this. So many community interpreting assignments are where people are exchanging quite personal, intimate details about their health, about their life, about their lifestyle, who they live with, what they're doing, their symptoms. For them to be able to divulge that information confidently, they have to have the confidence in the interpreter that they're going to keep that information private and respected. That is a genuine fear that they have. And you as patients also would feel fearful if there's another person in the room that you don't know, and you don't know what their obligations are in terms of keeping things private. This is a really key thing that we need to convey. And at present, we're not doing it so well. 42% had no idea that interpreters were bound by a code of ethics. If they don't know that, then they're likely to think, well, this person might be helping out with language, as they put it, but they're not bound by any other ethical requirements. That's a concern. So hence this project to address this lack of knowledge.
Thanks, Jim. So we asked patients what they like. There were some verbatim comments. I should also say that this is a Northern Health. We had, at the time, I think we had like almost 40, 50 in-house interpreters. So this is a fairly culturally competent health service. So these numbers are even more compelling, if you like. What they did like is that they're fully understanding everything that is said. It enables me to understand medical terms and medical diagnosis and treatments. Everything gets said to me, suggesting that when a family member is interpreting, not everything is said to the patient. Enables me to feel confident to interact, ensures I'm not left out. Again, a very telling comment or theme that emerged from the survey. Spares my family members from having to interpret. Those of us who have interpreted for our parents, we know how emotionally difficult it is to do something like that. Enables me to have independence and privacy from family members. There's a good understanding of that. And family members are not satisfactory interpreters. Again, it's a very true comment. What they didn't like, those of you who have worked in hospitals, availability, waiting time. But waiting time is an issue across the board. It's not just an issue about interpreters. Lack of trust. Many of them said to us, we only trust family members. Doubts about the general ability of the interpreter, levels of accuracy, and having an extra person there. So this element of having a stranger there. So interpreters being seen as a stranger rather than being seen as an integral part of a multidisciplinary team looking after the patient.
So, yeah, to sum up some of these conclusions, 15% of informants still don't know that they have a right to interpret. That's a finding which I talked about before. Others don't request interpreters. That's an issue that we need to get onto. That's perhaps not AUSIT's brief, but it's one thing that AUSIT needs to be cognizant of. And I'll leave you also to read the final findings as well. But these are things which are addressing through, as Emiliano said, a resource which aims to be available in many public places and to reach as many people as possible in a prominent, spot, etc., with the option of a QR code for them to then find out further information.
So this is a poster that I hope you can all read it out there. We effectively recommend that a campaign be done by government, and I'm really, really happy to see that Nati is already working on such a campaign. And this is the poster. So as you will see from the poster, it really addresses all the gaps that the surveys are highlighted, and it intends to inform the patient in their own language about what the role of interpreters is, and at the same time, it is reminding the clinician about the interpreter's role. Did you want to add anything else?
And this is one way we hope, which will add to patients requesting. This is interpreted, this is available in other languages, etc. This actually removes the barrier in places when they're waiting or going past, etc. The hope is that this will increase the percentage of patients who actively request one. It is better, it's easier if they are in a position to do so, so they're more likely to be able to receive what they need. As I said, the level of healthcare staff picking this up is high, and it needs to be high, but this is targeting basically at our potential clients who at present are not using our services and could be and should be. Thank you.
We have, I think this one, yeah. We have time for a few questions, perhaps 4 or 5 minutes for a few questions. If anybody has some questions, I see one over there already, and there's a few more up the back there. Thank you.
Congratulations on your work. Apart from the poster, is there a thought about wider communication campaign using other channels that the people might be accessing this information about interpreters, just to spread the word through different digital channels and other type of media?
As I mentioned before, last week I was at another conference and Nati presented. My understanding is that there will be a national campaign on raising awareness about the role of interpreters, but that's a question for Nati. We will be using the Victorian government to disseminate this poster as widely as possible, and we're very happy to disseminate it free of charge to whoever might want it. Yep.
Yeah, one is still in there. There was one down here.
Also, congratulations on a great resource that you developed. Angel Bogic, which is my name. I'm from Queensland Health Language Program Manager. I see a very good use for this poster to disseminate across Queensland government agencies. Just a question, you've just answered half of the question there through FECA's responsibility, but did you guys have any ideas on how to best disseminate it to the people who need it most? In language.
There was Nati, not FECA. It was at the FECA conference that I saw that paper. Look, I will be speaking to the Victorian government about this. So as far as Victoria is concerned, there will be, I hope, an internal campaign. Beyond Victoria, I'm more than happy to work very closely with Nati to help.
Thank you, and I'll probably be in touch because we want to do the same in Queensland, and as the language service lead agency, Queensland Health has the remit across all the other agencies of Queensland Health, so more than happy to promote it. Thank you.
I think the next one might need to go over the other side and up where Chris up in the middle there.
Thanks. I loved your statistics. I love a good statistic at the beginning where you said how many people use them, and it just gives a good before picture. My question is obviously, are you going to document exactly how many of these are printed, where they're stuck up, and then go back 6 months later and ask exactly the same, do exactly the same survey so we can see the after, so we can see if it worked? Is that the plan?
Yes. The plan is for us to be picking up how many hits this attracts. Secondly, will be those outlets, those healthcare facilities and those public places that are happy to distribute this. We will be contacting with longitudinally to work out, okay, what's the level of interest that the front of house staff have picked up from people, if they ask any questions, etc. We'll be able to track it by numbers of hits, and we're hopeful that that's probably the most efficient way, because there is the QR code to record how wide its spread is.
Hello, my name is Mikoto. I'm a Japanese interpreter and translator. I'd like to ask you about the use of AI in medical setting. I just wonder that, are you doing any education in healthcare? Because if the patient don't use the interpreter but use AI, I think that we need education for the patient, saying that it's actually not confidential, that kind of thing, and also to the hospitals. I just wonder that if we could include some of the sentence like that.
The primary intention is for them to know that interpreters exist, so that they don't come along with their smartphone and use Google Translate in the false belief that that's what they have to do, because there'll be no one provided for them. So this program obviates or aims to obviate that feeling that people might have that they should do this. The whole topic of AI and the use of artificial intelligence and speech recognition technology, etc., is a big area. I think I'm speaking to people who are well acquainted with this, but the actual level of accuracy, the level of risk, just to talk about speech recognition technology, it's premised on the fact that the speaker will speak slowly, clearly, loudly, a standard variety of that language. I will not use any euphemisms, figurative language, etc. Now, I don't know about you, but most of the clients I work, particularly in a health situation where they might be in pain, etc., don't always speak loudly, clearly, in the standard variety of that language. And even for English, the pickup, as we've also seen from when the speakers, and I'm not criticising our sponsors for the level of quality for the automatic caption generation, etc., but we have major shortcomings, even in English, which is by far the best service language in terms of AI technology. So what I'm saying is, I think we all are in agreement that AI is there, but it doesn't do anywhere near the job that it needs to in spoken, let alone sign language interpreting interactions. That's actually a separate area, which I think some people will be talking about at this conference. But it's a big topic, I agree, and there is a lot of research happening. And so far, and I'm happy to point people to results, etc., the results are actually, when you look at the output and the effect, are more dangerous than we've even suspected. But more about that later.
And I should also add, from a Victorian government point of view, the language services policies are being reviewed, and AI, there will be a section on AI and alerting users to the dangers of AI.
We have time for one more very short question.
Kia ora, Jim. Kia ora, Emiliano. This is Agustina from NZSTI from across the ditch. Thank you for your work, especially Jim. I've basically cited every single one of your papers saying that we need more research, and I've used them to justify my research with CULT communities. But my question is in relation to that. Do you think we should be doing more work to find out what CULT communities or, non-English speaking people want from interpreters and what our role should be, rather than going out and educating them on what we think it is?
Absolutely. We know very little. They're a hard-to-reach group because in the first place, and this is a paradox, one of the paradoxes, one of the things we had to overcome in collecting this data from them was who could we use or who could we press into service to get their responses? They can't give responses in English. And we also don't want to subject them to a written questionnaire. So the way this was handled to collect responses from them, another interpreter in that same language pair was used or was employed, etc., to elicit this data. It was voluntary. It was typically after they just worked with an interpreter after an assignment. But this is a logistic and also ethical problem we have to deal with. And the optimal way is to get a person that they haven't worked with to collect data from them, and for that person to also declare their own impartiality. We know that you've just been working with an interpreter, but I would like to ask you some questions and you can answer frankly, and there's no risk or disadvantage that you'll incur. We know, like I said, we know very little, so we do need to know. I mean, I'd like to know all the time, what did you think of how we worked together? I have no idea. I mean, I get compliments and that's nice, but I don't know if most people are happy with me. We don't know enough, and the same goes for translators. I also work as a translator, or Moonlight has one. And I had talked to my translation colleagues, how do you know how your translation is being consumed by the users of it? We have very little. There's an area called reception studies, which is a tiny academic area, but there's hardly any evidence, there's hardly any research. We don't know. And if we knew more, we'd actually be more informed as we approach translation as well as interpreting. They're hard to reach groups, but we have to start getting their voice heard, because our voice is heard to an extent. The English-speaking voices are certainly heard, but the CALD or LEP, whichever term you want to use, voices are very underrepresented.
Very quickly to finish off, the Victorian government will be launching a major multicultural health survey in 2026, and we will lobby the government to include questions on language services as well.
Okay, well, thank you very much, Emiliano and Jim.